Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARs is because it can induce lung cancer cell death. The main reason why I tried PPARs liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARs really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARs, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARs. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Nur Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPAR. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, gano'n. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
And we are live! Healthy day, everyone! My name is Jansen Lim and Dr, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of powerful food supplements made from a unique strain of microalgae called PPARs, which has been tried, tested, and certified to support not only cancer treatment, but also overall health and metabolic conditions like hypertension, diabetes, and high cholesterol. At this point, I'd like to thank everyone who tuned in Simply Nature Answers last night at its new time slot, Wednesday night at 7:30 p.m. Now, moving forward tonight, we promise to dive deeper into making your healing journey more hopeful because tonight's session is entitled Side Effect Shield, Practical Tactics for Chemo and Radiation Days. I'd like to know how many of our viewers are currently undergoing treatment. So please comment down on which chemo or radiation cycle you're currently on. Is it your first time, or are you already on your 4th, 5th, or 6th, or perhaps 20th, or even 35th? Believe me, sometimes it really takes that long. So prepare your notes because tonight isn't just a lecture, it's a survival toolkit you can start using tomorrow. Let's begin with understanding what happens inside the body during treatment and how small but smart choices help shield your energy, your appetite, and your immune strength. Now, when therapy kills fast-growing cells, both cancerous and healthy ones, inflammation and oxidative stress increase. So the body needs to divert the energy to repair, leading to fatigue, nausea, and low appetite, etc. Now, understanding why these effects occur helps us manage them. Your body is in intensive repair mode, and every supportive habit you add reduces the load. So start the day right with a morning shield. For breakfast, light, protein-rich boosts energy. Warm fluids enhance digestion and comfort. Ginger tea aids in reducing nausea. And a 10-minute stretch improves flexibility and mood before a morning walk that enhances overall well-being. Nausea is worst when your stomach is empty. So small, warm meals and movement reset digestion and mood. During treatment, hydration with 2 to 3 liters of water daily supports detox and bowel health. And steady energy with small meals every 3 hours prevents sugar-driven inflammation. In the evening, your body repairs during deep sleep. So set a routine, same time daily, right after you watch our webinar. So every early meals help promote digestion and rest. Foods rich in magnesium, remember this guys, supports sleep and recovery. Actually, PPARs tablets also contain magnesium, so good for us. And establish a relaxing routine to signal bedtime. Yan. Next, light exercises like with stretching bands or short 10 to 15 minutes walk after meals improves circulation and immunity and lowers sugar and inflammation. Now, let's take a closer look at something we often talk about here, PPARs. It means peroxisome proliferator activated receptors. It's a cellular switch that regulates how our body handles inflammation, energy, and repair. In simple words, PPARs help your cells function with discipline. They calm unnecessary overreaction while energizing your healthy cells to heal better. That's why Simply Nature PPARs made from microalgae are often used by patients undergoing chemo or radiation, not as a cure, but as a powerful ally for recovery. They support your immune system, help manage inflammation, and maintain appetite and energy so your treatment can work more effectively. I've personally witnessed patients who shared how adding PPARs into their care plan helped them bounce back faster and they could eat better, rest deeper, recover smoother between chemo cycles. And this isn't magic, it's biology done right. But don't just take it from me. You'll also learn from 2 of the most inspiring experts I've ever worked with. These are men who are walking testaments that science and nature can work hand in hand. Tonight, we'll hear from a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International. You all know him, our PPARs expert from Singapore, Mr. Shyan Lim. And up next is Dr. Jansen Calalan. He is a graduate of St. Luke's College of Medicine, a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening, gentlemen.
Good evening.
Hello.
Good evening, Doc.
Hello, good evening.
Doc, I'll be seeing you on Saturday. Hallelujah.
Yeah, see you.
you.
Excited to be there.
Yeah. Okay, Jen, let's go.
Okay, well, for those who joined us late, don't worry, this session is recorded. You can replay using the same link after the live ends. But please remember that what you'll hear tonight is for educational purposes only. It's not a substitute for your personal doctor's advice. Always consult your physician before making any changes to medications or treatment. Info. And for, we have some previous questions on yesterday's Simply Nature
Sure.
answers.
Sure.
Okay. Wait. Sorry, it's taking. This one. This is my 4th month on PPARs powder. My PSA went high. FBS is high. Borderline PREA. Also, since I started taking PPARs, I'm also constipated. It's from Jose.
Weird, right?
Weird. Okay. So,
Weird.
yeah, I'll start first, and then the constipation one. Drink more water. All right. So PPAR is, from a TCM perspective, is considered a heaty element. So you might you want to take more water. PPAR, one of the functions is it does promote detoxification. So drinking enough water is also very important, so that whatever toxins that are being pushed out, and again, PPAR makes your immune system more active, and as it's more active, you know, it's gonna fight the cancer or fight whatever illness, and that's gonna have additional waste products being produced. So being sufficiently hydrated is going to be important for you to displace out all these toxins. So drink more water for the constipation issue. Doc, for the diagnostics on the blood works.
Okay. So these are the conditions of the patient, right? So clearly, the issues are not being addressed. So to move forward, we have to address them one by one. Okay.
Yep.
So I won't say here if PPARs is working or not, because PPARs is not for those. It's not a medication. Okay. So it's a supplement used as catalyst to enact effect. Right. So number one, the constipation, you have to drink more water.
Yeah.
You know, take in more fiber. So it's really part of your diet. If you're addressing those that one already, those issues, then perhaps a probiotic might help with the constipation. Okay, PPARs powder is not supposed to improve constipation. Why? Because it's placed sublingual. You don't swallow it. Okay. So number 2, FBS. So if your FBS is still elevated, then clearly there's still insulin resistance going on. Okay, so you have to address the insulin resistance. How do you address that? You have to minimize fat intake. You have to exercise. You have to eat more fiber. So it brings out it goes into nutrition as well. So you have to bring down weight as well. If you are doing those things already, the lifestyle changes, if you're still obese or overweight, then guess what? It can still be elevated. So the next question is, do you have any medications that was prescribed to you before? You have to take those medications still, because those medications, they are medications. So these pills will enact biologic effects faster. But again, these medications will only put out the fire. If the fuel and if the things that makes, if the things that are still there that will generate fire, guess what? There's still gonna be fire somewhere down the road. Okay, so you have to address the root cause as well. Okay, so
So yeah, so that's the number 2 issue. The PSA being elevated, we have to look into your prostate. Why is it being why is it elevated? Is it enlarged? Do you have prostatitis, infection? A lot of things, a lot of factors that might be there. Okay, so yeah. So the short answer is the treatment is not enough. You have to go. You have to go back to and see your doctor and hey, come on, what's wrong? What am I doing the right things? If I'm not doing the right things, how do I remedy them? Okay, so these things have to be done.
Yep. I like what Dr. Jansen mentioned. PPARs, especially PPAR extracts, are catalysts. They trigger your body's systems to work. So it's really important to find out why the FPS is going up, which is really, Dr. Jansen, my first response is that's strange because PPAR extracts, especially the powder and liquid, is extremely effective for blood sugar management. So it makes us wonder what else is happening. Why is your FBS up? So the important thing is go for a consult so that we can find out. So again, this is really another very important part of why we have this program, because like many supplements and even drugs, right? If you take a drug and your blood sugar, for example, you're taking your metformin and your blood sugar isn't going down, it's got nothing to do with whether metformin is working or not. We have to examine to see what else is happening, right? Is it interfering with the effects of the drugs or protocols that you're taking? Because we know what outcome we are looking for. And it's already proven how the mechanism works. So we're pretty confident that this shouldn't be the results that you're getting. So this is very important for consult to then ask for more details. Exactly. And then what else are you feeling? Again, we also have to look at other aspects of your health apart from purely the diagnostic numbers, because you want to know how the body is reacting to the product. And also we want to know about your history. You said this is a 4th jar, right? So how was your first month, second month? Did it improve first? And then in this latest jar, in this 3rd month, if it's 4 jars, should be about 3rd to 4th month. In the 4th month, and then you do your diagnostics that has changed. So we got to know the history of the effectiveness from the first jar until now as well. All right. So this is why again we have this program. So please feel encouraged and know that we are with you, right? And that we will work with you and help you achieve the health healing that you are looking for.
Okay. Speaking of probiotics, that was also asked yesterday. Somebody asked, can I drink the cleansing plus together with probiotics?
Doc.
Yeah. You can.
You can.
Actually,
they should drink after, right? Should they let the probiotics settle in their gut?
Yeah. But you can take them together.
Actually,
it's okay.
can, is it? All right.
Yeah,
all right.
you can. But if you want proper timing, we
Maximum impact.
usually, at least me, we usually advise patients to take the probiotics before meals. Okay, so what you can do is if it is only these two that you're taking, okay, if it's only these two, so don't take this as medical advice or don't do anything with what you're doing right now with what I'm gonna say, okay? Because there are nuances behind this.
Okay.
So if assuming that you only have these two, prebiotic, cleansing plus, and a probiotic, whatever probiotic that is, okay? What you can do is take the probiotics first, wait for 30 minutes to 1 hour, then you can eat. And the cleansing plus you can drink together with your meal. Okay? Yeah, so that will help the probiotic settle in first. Then put in its food. So that's what you can do.
No, I have a question. Because we'll just focus on Philippines. Like in Philippines, if we get a probiotic supplement, it's usually minimum like at least 1,000 pesos, right? Then And then when we drink Yakult, it's like 20 pesos. So, and then, so I just want to ask this question. I'm sure is quite, I mean, in everybody's mind. As a doctor, right? As a doctor, is there a big difference between like probiotic that supplement, which costs like 1,000 pesos, and Yakult, which is a lot cheaper and honestly a lot more delicious also lah. So is Yakult like a therapeutic probiotic, or is something that if you have no problem you take it like as how should we look at it?
Okay, I'm not gonna talk about Yakult per se, because
okay,
it's a
we're
company.
talking about probiotic drinks. Yeah, probiotic
drinks.
drinks.
Yes,
Probiotic.
probiotic.
There are many brands.
Yes. But in general, probiotic drinks contain sugar. Some of them contain milk as well. So why do manufacturers put in these two inside probiotic drinks? It's to feed the bacteria. It's to make sure the bacteria stays alive until it reaches your stomach.
Wow, okay. That's why.
Yeah, so that's the reason. So now the probiotics that you see in the market, here's the thing. You actually don't know if they're live or dead already.
Oh, that's true. Sometimes you wonder whether they transport.
Whether they're live or not, right?
Yeah, they taste delicious, but yeah.
And they're usually in capsule form or in powder form, sachet form, these things. So it's the same, the same principle applies. Manufacturers put in prebiotics to feed the bacteria to make sure that they're still alive. So now here's the thing. For supplements, it's going to be a little bit tricky.
Okay.
Because number one, it should say in the label that it's live probiotics, or at least there's some form of assurance for the consumer that, hey, what you're receiving are live probiotics. Okay? So it's very difficult to distinguish unless you buy the probiotic, then look at it under the microscope and see the bacteria moving around. Unless you do that. So typically, for supplements, if you are a lay person, the general rule of thumb is you get what you pay for. Okay? If you are, unguided, unless you do your research, do ChatGPT AI, do ask it for deep research. Does this brand does it contain live probiotics? Take a look at certifications, whatever, to give you that information. Then that would be that would give you the assurance on a certain level. But again, it's going to be difficult distinguishing that. Now, if I'm going to choose probiotic drink versus supplements that you buy from the health store, probiotic supplements.
Yeah.
If you're a healthy person, you are a person who's not sick, you're not overweight, you don't have any issue at all, then either one would do.
Okay.
Either one would do.
Then I will go for the cheaper one. I'll go for the 20 pesos.
I'll go for the cheaper. I go for the probiotic drink, right? I mean,
and it tastes good.
And it tastes good. I mean, I don't have any issues at all. You can drink it, once every single day. So that would be fine. But however, if you have health issues, then I won't go for the probiotic drink anymore, because you need therapeutic effects already. You need correction in your biologic systems. Now, this would bring you to the health food store already, or to your doctor.
Okay. All
right. So, of course,
it's a lot more expensive. It's really a lot.
It's a lot more expensive. Yes. The reason why it's more expensive is because the manufacturers making these probiotic supplements, they use multiple strains of bacteria with a special with a unique blend.
Yes.
That's why. Because they want to enact a biologic effect on the patient. So this is the reason. Now, if I'm a sick person and I have health issues, for example, I'm obese, whatever degree of health issue, you have health issues, no matter how mild it is, you would want your probiotic to be diverse. It should not just contain a single strain 2 strains, 3 strains. It should contain multiple strains. That is live. Okay, that's alive. Right? So the usual probiotic drink that you can buy from the supermarket, yeah, it won't apply anymore. Okay. Yeah, but of course, no, everybody can start from that. I mean, if you have health issues, if you're say you don't have it, you're just constipated, you want you to have a better bowel, but yeah, no problem. Go to the health food store and drink one. If it resolves the constipation, well and good. Okay, so going to, if you have more, health issues, a little bit severe, okay, a little bit, no, then yeah, you might want to look into, probiotic products that's kind of formulated for specific issues, because the gut influences a lot of biologic processes in the body, from your brain, from your eyes, from your lungs, to your gut, to your heart, to your skin. Yeah. All right. So this is how you approach things. So there's actually so one product would not necessarily mean that it would be better to other products, especially in this category that we're comparing categories, probiotic drink versus probiotics from the health food store. So it really depends on what health issues you have, at what degree of severity are the health issues are.
And Doc, just to confirm and add on to what you said, I've spoken to manufacturers of probiotics, and this is what they tell me also. Different people might be lacking different types of bacteria. So some people get very good results from this particular brand, and other people do better with another brand. It's really not saying that one brand is better than the other. It's depending on your suitability. And also sometimes you will notice in certain countries, one brand is the better seller, because every country's bacteria also different, the climate, the food that you eat. So certain bacteria strains are better for certain countries as well. So yeah, feel free to try another brand of probiotics if the one that you are taking is not giving you the results, right? It's got nothing to do with whether that product is good or bad product. I'm sure the products are all good, but whether it fits you or not, it's suitable for you or not. So this one is really something that you can try around. Yeah.
Okay, next question coming from Agnes. How do I take PPARs vial or powder if I am on oral chemo?
Oh.
If you're on oral chemo, what oral chemo do you have?
So Doc, I think that she's asking also, like, in general, what's the spacing before or after your oral chemo?
Yeah. Okay. My take on this have evolved throughout the years. So if you look into the past videos, you would hear me saying that, hey, it's okay. You can take PPARs together with your oral chemo together. Just a blanket recommendation. Now I have changed it. Reason being, number one, I don't want anything to be interacting with the chemo. Okay. So one reason is PPARs is a binder. It's made from it's a microalgae supplement. So microalgae in general are binders. So it might bind with the chemotherapy drug.
Oh, yeah, that's true.
So at least I ask patients not to take them at the same time. You space it.
So how far apart? An hour? 2 hours?
At least 2 hours.
At least 2 hours.
At least 2 hours, yeah. So now the next question is, will the PPARs be minimizing the efficacy of the chemotherapy? Because certain chemotherapy drugs have enact its cytotoxic effect or enact its cancer-killing effect by way of free radicals. Simply Nature PPARs is a substance that is very rich in antioxidants. So if you take them together, the PPARs might scavenge the free radicals coming from the medication. So how do I go about this? I make sure that the PPARs and the chemotherapy oral chemo is spaced at least 3.5 lives apart. What did I just say? Okay.
Yeah, very scientific.
Drugs have half-lives. So a half-life is the amount of time. How long does it take for the drug to decrease by 50% inside the body? Okay? So I want at least 3 to 5 half-lives to pass. So in other words, 3 to 5 half-lives. I don't know how to simplify it. But 3 to 5 half-lives to pass before you go for PPARs. Now, I will again go back to semantics, okay? Because oral chemo, sometimes the patient thinks that it's chemotherapy when in fact it's not chemotherapy.
Oh, okay. Please elaborate on this one. So, please elaborate on this one.
Example, I'll give you example. No? So chemotherapy drugs that are orally took, no, would be capecitabine. That's one example.
All right.
Okay. The other ones are usually IV. Capecitabine is one oral chemotherapy drug. Other oral medications that's not chemotherapy would include your targeted therapies. Okay, so one example would be osimertinib, gefitinib, erlotinib. So these are tyrosine kinase inhibitors. They are orally taken. You swallow them, but they're not chemotherapy. Okay, they're under targeted therapy as a classification. Okay. Yeah, but they have similar effects to chemo to a lesser degree. The side effects are to a lesser degree. Yeah. Okay. So me, when I say that Simply Nature PPARs might interact with oral chemotherapy drugs, I am particularly pertaining to capecitabine and the like. But I am not pertaining to the tyrosine kinase inhibitors, because the tyrosine kinase inhibitors do not kill cancer cells by way of free radicals. So you can take them together, but not at the same time. Okay. Yeah. So that's the nuance behind it. That's the nuance. So yeah.
So again, back to the very first question that we had tonight, where the viewer was asking, they've taken 4 jars of the PPAR powder, then some of the blood works that come back. The results are not what they were expecting, and it also surprised me and Dr. Jansen. So what we're saying is that this journey that you're taking, right, know that it's a unique, everybody's body is unique. So be very comfortable that you need to go for a consult, that you need to find out more information, that you may have to adjust the way you're using the protocols that you are using. And also, you have to also examine the way, is there any other things that specifically for you need to do that will really trigger and create the results that you want? So on a totally different topic, but on the same kind of concept, is osteoporosis. Many people want to take calcium supplements for osteoporosis to strengthen their bones. But it's only when I met with Dr. Jansen did I realize that you have to do weights. So you can eat all the calcium supplements you want, but if you're not doing weights, you won't cause your bones to absorb and use that calcium to strengthen its structure. So you have to do weight resistance training when you're trying to take calcium supplements to strengthen bones. You see, so you could be taking lots of calcium supplements and giving yourself a kidney stone, okay, and your bones are still as weak. So it's not that the calcium supplement is not working, but there might be other things that other people do, but you don't do, because maybe your specific lifestyle has or your specific habits are unique or more unusual. So that's why we have this program. Always ask questions, and so that you can explore and understand how to make the protocols that you're using work better for you.
All right, next question coming from Miss Emma. Doc, are cleansing plus and tablets sufficient for CKD po? I'm on dialysis 3 times a week.
No. The answer is no. Again, if you're someone who's sick, the issues that you have has to be addressed properly. Okay? Cleansing plus and and the PPAR tablets will ensure that your gut microbiota remains healthy. It's a binder. These are binders, no? Cleansing Plus contains psyllium husk. Psyllium husk, it's a fiber. It also binds. So for CKD patients, binders are important because you do not want too high of potassium. You don't want your phosphorus to go up that so much as well. So these two substances are there. It plays a role in your health care, in your protocol, your treatment protocol, but these two will not. If you're expecting cure, no. Okay? If you're expecting cure, no. If you're expecting to go off dialysis, then no. Because the issues that you have has to be addressed properly. Every single product has key roles to play in your treatment, in your management. Okay? Especially with CKD, a very complex case. So it's not one or two pills given to you, you will heal magically. Because again, the case is complex. It's very complex, especially for a dialysis patient.
Yeah, one of the reasons why it's also very complex is because there are many reasons why you develop CKD, right? There are many factors. It could be your blood sugar, it could be acute injuries, it could be other illnesses as well. So you got to know which one is the one that is causing your CKD. And again, of course, if you're in the early stages, there are more options that you can do to halt or to delay the progression of your CKD. And maybe in the very earliest of stages, you can even recover. But once it reaches the late stage CKD, it is very hard. And at that point, our primary goal is to make sure that for example, with your dialysis, you actually can live a healthy life, right? So you want to help the body, support the body's other functions as efficiently as possible so that you can have a long life even though you're on dialysis. So that will be more to support your dialysis rather than to treat the CKD, which is in late stage very difficult to treat, or in fact not possible anymore, right?
This one is also asking about tablets. Gastric cancer with liver metastasis and esophageal lesion on the brain. So I need to boost the immune system. Is tablet enough? What should I take? I recently went on chemo.
Yeah,
Mr.
no.
Arnel.
Okay, you're on chemo. So okay. Okay, let's break down the case, no, the question.
Okay.
So you're someone who has cancer, a very aggressive one at that, with that is metastatic. So if that is the case and you're on chemotherapy, then the goal would be to support you so that you're able to finish the chemo. So if the goal is to support you, then sometimes tablets would suffice. Yeah, sometimes tablets would suffice. But if in case that it's not, then I would go up to extracts.
Yeah.
Now, if you don't have issues with budget, I would automatically go for the liquid.
Yeah.
Why liquid? Because it's liquid. It's easier to digest. Okay. Yeah, so that's the main reason. And of course, number two reason is that it has the highest concentration of PPAR agonists, which you want, right? If PPAR's liquid would be a challenge, then I'll go to powder, because powder bypasses your stomach. So you just have to place it under your tongue, then it works. Then it works. Okay. Yeah, that's how I would go about it. But of course, no. If it's just really supportive, if it's really supportive, that's the only goal. Then you can start with the tablets, then go up to soft gel. Okay, so sometimes those two would be enough already. So now, how do you know if it's enough? You're on chemo, right? You're on chemo. Then you need a doctor to tell you. Number one, I would look into your complete blood count and look at your lymphocytes. Okay, so the amount of lymphocytes should be sufficiently high. Now, of course, well, I don't look at a WBC per se, because the WBC will go down, especially when you're on chemo. The question is your immunity, despite being low, is it enough to combat infection? Or is it functioning enough to help curb the cancer? So we look at lymphocytes for that matter. Now, if so that's one. Another metric that I would look into is you. Things that you are feeling. Yeah. Okay, like your fatigue, these things. No? Yeah, your level of vigor or resilience, perhaps. So you overall clinical picture. That's what also I would look at. Then if still we're not satisfied, then we go up to extracts. Now, if still the extracts seems to be inadequate, then we include other products already. Yeah, but that's how I would go about it. Okay?
Yeah. Nothing. I mean, exactly everything Dr. Jansen said, right? Yeah. How to put simply, right? The tablets are what. Like for example, for cancer patients, your nutritional intake, right? You're taking like Ensure. So when you go in and take Ensure, you drink Ensure, you are thinking about the nutrients for your body, right? So I think that's how I will look at tablets too. Is supporting your fight against cancer by giving you good nutrition, and specifically also the tablets do help in terms of inflammation and things like that. So it's better than Ensure, because if you drink Ensure milk, Dr. Jansen has said it many times, the negative side effects of dairy. So if we can avoid dairy source of protein, that's great. But if you can't, then no choice, right? So it's from that angle. But if you're looking from what I hear from you, maybe it's the way the question was read. There was a hope that this will change your cancer tumor size, and that improve, basically help you succeed in fighting cancer. Then if you want that, really is the extracts. All right, but so it's not your primary, it's not like a strong effort to reduce your cancer markers, your tumor size. It's more to support you while you're going through other therapies. Then tablets is the best support that you can going through other therapies. Yeah, but if you really want to see impact apart from support, then like what Dr. Jansen said, I will also say you would have to go on the extracts. Yeah.
Since we're being specific, this one is asking, is Berocca good for a cancer patient?
Berocca.
Yeah,
is
it's
it?
okay. Yeah, it's okay. I mean, it's vitamin C, some minerals, I guess. Yeah, vitamin C is good for a cancer patient. Yes, the answer is yes. But again, if you're a cancer patient and you're undergoing chemo, I won't I won't take it if you're undergoing the chemotherapy. Space it out.
Oh, why?
Yeah, because vitamin C is an antioxidant that will influence the free radicals from the chemotherapy. So you can take it, but not during infusion. You have to space it out. Yeah.
Doc, I want to ask you this question, right? This question. From a nutritional point of view as a doctor, number one, Berocca, if I take Berocca, it's actually because I want to. It's an excuse to take a gassy drink that is sweet. But I do notice something, Doc. If I take a high dose, a multivitamin, right? Generally, multivitamin or effervescent like Berocca, my urine color, like 2 hours later, is like fluorescent. I mean, it's different from when I don't take these things, right? But then when you take like natural supplements, like for example, curcumin, malunggay, PPARs, you don't see that change of color in your urine. So, what does it mean? Does it mean that all the minerals that you're supposed to be absorbed is just coming out, and then you didn't absorb a lot of it? Yeah.
Okay. A few points, no. Number one, you want your urine to be yellow. You
Oh,
want it to be
okay.
yellow because that means you just absorb whatever you took.
Huh.
Okay. So for a product to work, it has to be absorbed first.
Okay,
So
okay.
that's what you want. Number two, the yellowness of the urine is because of it's because of vitamin B. It's because of vitamin B.
Vitamin
Yeah,
B.
so B, boy.
Boy,
Beta.
B. All right, all
Yeah,
right.
it's vitamin B. That's because of it.
Yeah.
So if you're taking any vitamin B's supplements, then expect your urine to be yellow.
Yeah, because
Which
every time I
specific
drink, because every time I drink Boraka, right, which I do enjoy drinking, I just feel like, hey, is everything coming out? Am I absorbing anything at all? You know, because the color of the urine. So it's a good thing. It's actually a positive sign.
it's a good thing. It's a positive sign.
All right. Okay.
Now you might be wondering, okay, I am taking B complex, doc. Why is my urine not yellow?
Yes. For example, right? Like
B
if you take,
complex. Okay.
or you take like
Because-
cod liver oil, right? You take fish, very rich in B3s, right, and B complex. Your urine doesn't change in color.
So why is that? Yeah, doesn't change in color. Why? Because the vitamin B that makes your urine yellow is B2, riboflavin.
Okay.
Riboflavin, okay? Riboflavin is B2. The B complexes that you get from the pharmacy, the usual B complexes is 1, 6, and 12. That doesn't change the color of your urine. So, I mean, you would want your urine to be yellow if you're taking a multivitamin supplement, because multivitamins usually have B2 or
all right.
riboflavin.
Okay, finally I get to ask this question, because okay, that's good.
Well, we're almost
Jen?
at the end of tonight's session. This will be our last 3 questions for the evening. Next is, how can PPARs help with myasthenia gravis?
Oh, myasthenia gravis. Myasthenia gravis is an autoimmune disease that attacks the neuromuscular junction. It's a mouthful, but it attacks the part of your body wherein the nerve meets the muscle. So for myasthenia gravis patients, you have difficulty in moving your muscles. So you have muscle weakness in general. Now, this is an autoimmune disease, no? So inflammation is still a big factor here. So with PPARs, it can help with your overall health in terms of inflammation, because it's rich in antioxidants. Number 2, it is something that can also feed your gut microbiota, so that your gut microbiota can modulate your immune system to reduce flares. Okay? Now, this is not a treatment. So if you are someone who has myasthenia gravis and you stop taking everything and you only take Simply Nature PPARs, it won't work. All right, you still have to take your medications, the necessary medications. Now, I might say I might add, no, or I might at least look into the vitamin D3 levels of a patient who has myasthenia gravis, because usually for autoimmune disease patients, they have vitamin D3 resistance present. So with the D3 resistance, they experience vitamin D3 deficiency symptoms even if they have adequate amounts of vitamin D in their blood. Okay? So what you have to do is to increase your vitamin D3 levels high enough to force it inside your cells. So you enact the biologic effect. So the biologic effect, so how can D3 help patients who has autoimmune disease? It modulates the immune system. It decreases the flare-ups of the immune system. Yeah, so that's something I would look into.
All right. All right.
Yeah. I agree,
I was
because
just-
Doc Jansen prescribed vitamin D3 for me.
Yeah, no, I also noticed most people seem to be lacking vitamin D.
Especially nowadays.
Yeah. And this is something maybe I will go and pick one up on the airport tomorrow also.
Yeah.
Yeah. When it comes to selecting a vitamin D supplement, what will you look out for?
Okay, the
Does it need to
dose.
be does it need to be paired with any other mineral or vitamin for
Okay,
effectiveness?
yeah. For vitamin D3, I would choose at least 2,000 international units. So this
Okay,
is for
2000 IU.
everybody.
That's number one.
2,000
Okay.
IU. So this is for everybody. Now, if you are, so this is just a ballpark figure, right? So without seeing a doctor, what do you go for? Okay, without seeing a doctor. If you are someone who's perfectly healthy, no health issues at all, 2,000 international units. Because you get about 2,000 international units of vitamin D3 if you get around 20 to 30 minutes of direct sun exposure at noontime.
Okay.
Yeah, so 2,000. Now, if you have health issues, no, especially inflammatory ones, then I would go for 5,000 to 10,000
Wow.
international
Okay.
units of vitamin D3.
Okay, is there is there such a thing as, vitamin D poisoning? I mean, how do you know when you are taking too much?
Yeah. So we look into the calcium levels of a patient.
Okay.
So usually vitamin D, the main role of vitamin D3 is for you to absorb calcium from your diet through the gut. So if you take so intuitively, if you increase vitamin D3 intake, then you would absorb more calcium from the food that you're eating. But there's a limit. The limit is the amount of calcium that you're taking or you're eating. Okay. So increasing vitamin D3 in high amounts doesn't necessarily mean that you will also have an elevated or abnormally high calcium levels in your blood. Okay? No, but intuitively, yes, it is. No, because that's what vitamin D3 does. So the side effect now will come from the high amounts of calcium that is present in your blood if it is at all elevated. So that's what we look for as toxicity. So some symptoms of high calcium levels would be flaccidity, muscle weakness, palpitations. You can also develop kidney stones from there.
So taking too much
yeah.
vitamin D supplements can actually give you kidney stones.
Not the D. Having high amounts of calcium in your blood, yes.
Okay.
So there's a difference.
Okay.
Be careful of the difference. So the
Yeah.
amount of D3, then how do you know how much D3 to take?
Yes.
Then we look into your parathyroid hormone. So that's another blood parameter. We want parathyroid hormone to go down. So that's when I know that, okay, the D3 that you're taking is working already, or at least you have overcome the vitamin D3 resistance present in your that is present. Okay, so the dose varies from person to person.
So if we take let's say even if you are deficient, let's say we are deficient, we take 2,000 IU. If we take it consistently, doesn't mean that after 1 month your deficiency will be overcome. And if you and if you were extra deficient, it just doesn't mean that it just takes a longer time, maybe 2 months, and then you will actually hit the maximum. So that is no real, if you don't have an immediate health issue like right away, you can build up your vitamin D deficiency over a longer period of time, safer in a sense, because you are not sick or anything, and you don't run the risk. Okay, so 2,000 is 3,000 okay? Is 3,000 are you okay, or 2,000?
3,000 is okay. Well,
depends on the
it's
person.
difficult for you to find 3,000 in the market.
Okay,
it's usually 1,000, 2,000.
Okay. So if you are committed to taking vitamin D3 every day forever, then 2,000 will be a good amount.
2,000, at least 2,000 for you not to get sick. But if you want to be at optimal levels, go for 5. Go for 5. Some even go up to 10. So if
this
you
is
look
where orthomolecular
that's orthomolecular already.
Yes.
Okay, for longevity medicine, so we're talking about lifetime intake. So you want to be healthy. So longevity medicine advocates advise 10,000 international units.
Oh, but
10,000. So
I,
that's high. But again, the toxicity comes from the calcium, not the D.
no, I think maybe in 2026, right? Maybe we can do a series on longevity. We always do a series on cancer, but we could probably do a series on longevity, as in like what are the options that we can look into for longevity. All right, so yeah, if you're interested in that, please make comments. Ask us to do so we can start doing our research and comparison, and just some useful tips like what combination of supplements and at what
Yeah, yeah, yeah,
concentration,
yeah.
at what
Oh yeah.
concentration.
The other question you asked, what minerals or other things that you can
Yeah, to
that
take
would
with
be
the
good to
D3.
add to take with the D3. So number one would be K2. K2 is MK7 or menaquinone.
Okay.
Not the ordinary K ha. There's a difference, no? So menaquinone, MK7. So K2. Another one is magnesium. These two. If you don't have health issues, no, the one that you have to look for would be magnesium. Magnesium takes is more important actually.
Oh,
Yeah.
okay.
But
I was
say
thinking,
for example, you have heart issues, blood vessel issues, plaques, then go for the K2.
okay. I was just
And the
thinking,
punch.
you mentioned that D3 will help with the uptake of calcium, and calcium is very important in muscle function. So, and then magnesium is very important for in muscle function as well.
Muscle, yes.
Is that why you pair it up, or there's another reason why you pair it?
No, another reason. So
Oh wow,
the
okay.
magnesium will help your bones.
Whoa,
Yeah, so
okay.
magnesium is also important for building bones. Of course, for your mood, muscle function as well.
Okay.
So yeah, magnesium is everywhere, but it would be good to pair with that. So magnesium also helps in pushing the calcium in your blood to your bones. So it has similar effect as K2. K2 is the main vitamin to push calcium in your blood into your bones. So that's why K2, yeah, actually they're both important, equally important. Yeah.
All right. Okay. Thank you, Doc.
Okay.
I learned something today. I got something out today. I'm gonna act on it tomorrow at the airport. I'll buy already.
Okay, second to the last question. Have you had any successful leukemia patient?
Yes. The answer is yes.
Leukemia, yes. I've had a few.
Yeah. Maybe GN is one of them, right? Is she a leukemia
No.
Legit.
She's not.
No. There's
She's not,
one
okay.
child house patient. One child
Oh.
house patient.
All right.
Yeah.
But
One.
yeah, we've had experience with that. But then again, that particular doctor just let us know, didn't give us the patient file details. So don't. But the answer is yes. Yes.
Okay. Last question. Is cod liver oil good for cancer survivor?
Oh, that's interesting.
Answer so yes. Cod liver
That's
oil,
true,
yes.
right?
It's omega-3s.
Omegas.
Omega-3. So omega-3s in general, actually you need omega-3s. So if you're looking into cod liver oil, yeah, go ahead. It's okay. Mhm.
Yeah. Yeah, get the orange flavor one. The original flavor one is tough to take.
Okay, well, it looks like we've covered all our questions. So,
Oh, wow. Okay.
yeah, as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Doc.
See you on Saturday.
Yeah.
We hope we get a room packed of people, no? A room full of people. So yeah, looking forward to seeing you on Saturday. And yeah, that would be it for me. I'll give the floor to Sir Shyan.
Same. My parting words is see you guys on Saturday. We will have fun. The last time it was a totally packed room. We literally had to pull chairs in and don't know where to stack the chairs. We hope the showing will be good this Saturday. Yeah, so looking forward to that. And once again, thank you everyone for being here with us. We've been doing this program for 4 years now. non-stop. I think we only missed three Thursdays out of the last 4 years. 3 or 4 Thursdays for last 4 years. So thank you for being with us. And we hope to see you soon. And we'll continue to be here every Thursday night to answer your questions, and wishing you guys all the best. And our prayers go out to all the persons who were affected by the recent typhoons. I know it's tough. It's always tough, when the floods hit and it affects your home. Definitely affects finances as well. But do take care of your health. All right. I'll hand the time back to Jen.
Yes, thank you so much to our experts, Dr. Jansen Calalan and Mr. Shyan Lim, for sharing their knowledge and insights. If you have any follow-up questions, where we will answer each of them next webinar via direct message or this Saturday. And we hope to see you again next week for another empowering session. Same day, same time, every Thursday night at 7:30 p.m. And this Saturday, join us for the upcoming face-to-face cancer seminar entitled Defying Cancer Diagnosis, Thriving with Science and Nutrition. That's November 15 in the morning, 8 a.m. at SMX Aura BGC Taguig. And let's watch this.
Hi, I'm Shen, PPARs expert from Singapore. If cancer is an important topic to you, your family, or a loved one, and you have lots of questions about cancer diagnosis, treatment options, or even how to prevent cancer recurrence, then we have the perfect solution for you. Mark this down on your calendar. November 15th, Saturday. Join me and Dr. Jansen Calalan, one of the leading experts in integrative cancer treatment, as we host the Defying Cancer Diagnosis Conference. From 8 a.m. to 12 noon, we will be exploring how PPARs, peroxisome proliferated activator receptors, can be a success factor in your fight against cancer. We will also be looking at successful cancer cases, and of course, the most exciting segment of our program, which is the live questions and answers segment, where Dr. Jansen and I will be sitting as a panelist to answer all your questions as honestly as we can. So if you have questions on whether you need surgery, when to do, what type of scans, how do you blend conventional oncological protocols and natural support or even natural treatments, this is the place for you. Ask your questions as we explore the answers interactively and honestly together. So, tickets and seats are limited, so please register with the link below. Dr. Jansen and I and our entire team will be looking forward to supporting you and answering your questions on November 15, SMX Aura, BGC, Taguig City. See you there.
Ticket is 250 pesos, so secure your seat now together with your companion for free, and register with the link in the description or scan the InstaPay or GCash QR on the poster. Exclusive on-site promos awaits, and great news, guys, the 250 ticket free is actually consumable, so it's just like you attended for free talaga. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we are always with you from start to healing.